You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. I'm so excited to have our next guest on. I don't know if we've ever met in person. Maybe we have, but I know we've chatted over the years. But Tia Ukpe-Wallace has just, she's a physical therapist, pelvic floor physical therapist, but just has a wealth of knowledge, not only navigating pelvic health, but, maternal issues. She's writing a book now, Tending to Your Womb. And I just wanted to have her on to just have a chat. Some of the other things we're going to talk about is grief and loss and miscarriage and those sorts of things. So Tia, welcome to the Active Mom Podcast.
Yes, thank you so much. And I think we did meet in person. I think it was APTA, like CSM conference.
That's what I was thinking. I'm like, yeah. I'm sure at some point we did.
I was still a PT student, so I wasn't even.
That's what it was. Yeah, okay, that's what it was. A whole other lifetime ago. All right. Well, tell everybody about who you are, where you're from, kind of how you got into all of this.
Yeah. Well, my name is Anietie Ukpe-Wallace, but I also go by Tia, and I'm a pelvic floor physical therapist, and I practice in the Bay Area. So I'm in Oakland, California. I've been practicing for a little bit over 5 years, and I have a private practice that's part of the East Bay Birth Collective, so which is really great to be part of a collective with other perinatal providers. And a lot of the population that I treat are those in pregnancy, postpartum, but I do have a small population of patients who are, have challenging fertility, and so working with them. Around that, some with pelvic pain. And then I do also have like a really small subset of those who are postmenopausal, or in menopause as well too. So which has actually been really fun to work with them and still address their pelvic floor issues, because there are pelvic floor issues that come up even after menopause as well too. But yeah, like why I got into this, I taught yoga, for a really long time before I had my daughter. And Jill Miller is, one of my teachers, and I would call her one of my mentors. And she really helped me to kind of like form, I think, like the path that I'm on right now. So I would say she was like a really big catalyst around that. And during that time, I started to do like more corrective exercises and like teaching more self-massage in my yoga classes as well too. And kind of like heard about being a physical therapist. I really didn't even know what PT was, because I never had to do it myself. And so found out, how to do my prereqs and everything like that. And sometime around that time, I was also struggling with a lot of pelvic floor issues. I had just gotten recently married as well too. And then like 3 months afterwards got pregnant, and pregnancy was going really great. I had been diagnosed with fibroids, was told that it wouldn't be an issue. I was asymptomatic and never had any issues with fibroids or heavy bleeding or any symptoms, but ended up having like a 20-week loss, with my first pregnancy. And so, that was like very eye-opening. It was like, and then how old was I? I was like 31, 32 years old. So I was like very naive and like, yeah, I'm going to get pregnant and I'm going to have like, a full-term pregnancy and like have my baby. And, any books that I read never really talked about, or maybe I didn't choose to read, into about loss or miscarriage or what that is. So when it occurred, it was a really, it was devastating. It was a pretty big loss in my life. But right when that happened was when I could have chosen to like either stay in bed and just like be in a very depressive state, or it was my first week of starting my prereqs for PT school.
Oh my gosh.
So, I had a week just to kind of allow my body to recover, and I went to class the following week. And I, like, even though the loss was, is tremendous in my life, and it's still something that will always be grieving, I'm blessed that it helped to push me, into the path that I'm in right now, because I don't think that I would be where I am right now if it didn't happen.
Yeah.
Um, so I ended up going into PT school, discovered I can be a pelvic floor PT from one of my professors, took a continuing ed course, and that really solidified that this is what I wanted to do. And in the midst of that, also, when I was got accepted into PT school, I had my daughter finally. So I ended up having a surgery, got rid of the fibroids, had to have a C-section as well. So having had like issues with pelvic floor issues, before my first pregnancy, having the fibroids, dealing with the loss, then having a myomectomy to remove the fibroids, then having her a couple of months later and realizing that I couldn't have a vaginal delivery like I wanted. So then having a
Mhm.
C-section, recovering from a C-section, and then also dealing with pelvic pain from not addressing my grief as well too, which still lingers. Now it's 12, 13 years later.
Yeah.
That's still a part of my life. All of that really like kind of culminated into everything that I do right now. So when I am working with my clients, my patients, like, yes, it is like I'm helping them to, prepare them for pregnancy, or prepare them for
Mhm.
labor, or prepare them for their postpartum. But also, like, a huge piece of it is the education, which I feel is such a big lacking piece.
Yeah.
In any aspect, throughout,
Yeah.
where the person is in their reproductive spectrum, even if it is in menopause, because there is like not a lot of understanding around that.
Yeah.
And when I'm working with those who have had a loss, whether it's at term or if it's like halfway through the pregnancy, um, there's even just like that educational piece of like just having that understanding of what their body went through
Mhm.
and why it's really important to be able to reconnect, to their body, and not having it just come from a place of um, okay, like, they had the loss, and okay, let's move on to the next thing, but also to
Right.
be able to sit with that grief and like, what can they learn, from their grief? What can they learn about their body because of the grief as well, too? I'm just thinking about one patient that I just had recently who had a very similar loss that was similar to mine. So it was like, it felt really close to home. And we
Yeah.
worked on so much more, like, again, she wants to have, a full term pregnancy, and, choosing to go through like a cerclage, this next time around.
Mhm.
But then also just having a better understanding of like her own pelvic health, and then she had a lot of pelvic health challenges, being able to feel her cervix, which she had never ever had done
Yeah.
before. And especially because she did have, what they term like an insufficient cervix.
Mhm.
And she wanted to understand, like, well, why did this happen? And then even being able to connect with her cervix that
Yeah.
had created, that loss. And I think in a way to be able to create some closure, or
Yeah.
at least like to be able to sit with like that understanding of why this happened,
Yeah.
and work on
What
so many other aspects.
Well, even just taking a step back and having someone to talk to.
Hmm.
We had a loss between our kids at 14 weeks. I unfortunately found it myself because I had ultrasound and noticed
Hmm.
something was up and hadn't been feeling well. And even telling other people what
Hmm.
was going on, there wasn't anybody that you could talk to. I
Yeah.
mean, it was, and so for someone to know, and I'm sorry that that was the education that you had. We did not get any education either in
Yeah.
PT school, in pelvic health training about how to have conversations with women going through loss.
Hmm.
And I think I see a lot more questions now. One, because I think people are more open to sharing that in certain forums, but they're like, what do I do? I don't know what to do. And I very much was like you. I was a runner at the time, but I turned to yoga. I was like, running doesn't feel right to me right now.
Yeah.
I turned to yoga, kept through that with my second, I'm sorry, after my daughter was born. So technically she was our third.
Hmm.
But again, like you don't know what to do. So like, how do you start that conversation? Does someone come to you and say, hey, this is what's happened to me? Like, How does that usually evolve for people to get help?
Well, I think, I mean, at least in this particular case, I share my story on my website, so
Mhm.
like on my, if people are interested in, booking with me, and I talk about it. And I think that just to have that vulnerability of like, yeah,
Yeah.
this is what occurred, this is what happened, and to just be, have that vulnerability to be able to discuss it. I feel like that's the first piece that
Mhm.
then, if someone, a patient is looking to connect, with a provider, to be able to then feel comfortable talking about that. I feel like, that's important. And I don't think that like necessarily for like every provider, they probably haven't experienced some type of loss, but I think even for a patient who's looking for a provider
Right.
to go to, that they can feel comfortable speaking about their loss. And even if half of the session is just really talking about their loss and what they're going through, but
Right.
knowing, that, and I think just in some aspect that they're able to describe that or talk about that, whether, as part of their practice on their website,
Mhm.
if they're having that initial consultation, just so that they know that this is a safe space that they can be able to come and
Yeah.
grieve, as well, whether it's like on the table or while they're in the chair, during the evaluation, I think
What
is a
helped
big piece.
what helped you make that decision that that was something that you felt safe enough to share and you wanted that to be a part of kind of that safety that you offered?
I think because I didn't find that. I
Mm.
didn't have that.
Yeah.
Also, I mean, like when I had the loss, so it was definitely, I wasn't in grad school yet. I was a yoga teacher. Like I didn't have a lot of money, so that was one. I was teaching a lot, and so it was, first of all, it was really hard just for me to like seek out a pelvic PT.
Mhm.
And also that wasn't really in my wheelhouse. Like I wouldn't think like, oh, I had a loss, let me seek out a pelvic PT.
Right.
For me, or at least like what was given to me was like go to a grief counselor, and I
Mhm.
did talk therapy, and which was great. It was helpful, but I didn't have that physical aspect,
Right.
around holding my grief. And that was what eventually ended up manifesting into pelvic pain. And I didn't realize at that time that, someone
Mm.
could actually help me with that. And it was luckily like Tammy Lynn Kent, like it was, I remember like within that month of having the loss, and I think I had already bought the book Wild Feminine. I just never read it. And I think
Mhm.
I was looking for something. So like the two
Yeah.
books that I remember reading was Taking Charge of Your Fertility by Toni Weschler, and
Yep.
then Wild Feminine by Tammy Lynn Kent. And then reading her story, like reading that she was also a pelvic PT, which I
Mhm.
didn't even realize like was a thing. Um, and then also she had like such a holistically minded way of like looking at the womb and caring for it. And she spoke about grief as well. Like for me, that was
Mhm.
what opened my eyes, and it's like, okay, well, like if she's a healthcare provider, but
Right.
then she's not like the traditional healthcare provider. Like that was what I wanted to be, and that's what I'm hoping I am, is that
Yeah.
I'm much more than just a pelvic health physical therapist, but I'm also can be a place where someone can come to talk about their
Mhm.
grief, to know that that I can be able to hold space for them, that I can do more than just work with my hands, or that even if I am working with my hands, that also is a place of safety. It's also a place of healing for them as well too, with like me just placing my hand on their belly or on their back, without feeling like it has to be, I'm doing a mobilization, or, it's just
Right.
holding. It's just holding and listening and hearing them, even if there's nothing that they're saying, but I'm listening to what their body is telling me.
Yeah.
Um, and yeah, I mean, like, yeah, and I think that has really resonated with my practice. And I feel like the
Mhm.
people who have been drawn to my practice, have really, I'm hoping, thrive from that.
Yeah.
That, it's really, yeah, it's just, that vulnerability, I think, is just like that big piece. And a lot of it was just like, I didn't get that. And so
Mhm.
I was seeking that. And so if I were ever to be in that situation again, I would hope that I would have a provider similar to me that
Yeah.
I could go to. So I think it's really just being able to be that mirror so that I can be able to provide that for others.
Yeah. I'm thinking even just basic post-miscarriage care
Mhm.
really isn't there. In my experience, We found it. I had a DNC late on a Friday night. I think I went in 2 weeks later. I had my son with me at the time. He must have been, maybe a year and a half or something.
Mhm.
The hospital had just switched, or at least that office had just switched, from paper charting to electronic medical records, and my GYN comes in, and he's like, "Oh, 15 weeks. Have you felt the baby kick yet?" And I looked at him and I said, "You did my DNC 2 weeks ago." And he's
Ah,
like, "Oh my gosh." And he goes out of the room and you can hear him yelling at people. But I'm sitting there with my son. I can't lose my shit at this point because he's
yeah.
little. And when we got pregnant later on with my daughter, um, I was like, do I go back to this guy? My husband's like, you can't go back. He's like, you
Mm,
can't. And so when I was interviewing people after that, I was like, you need to know what I just went through because I can't do this again. Like,
yeah.
and but again, like even just the basic physical changes that occur in that period of time, your body was still pregnant.
Mhm.
I didn't lose that weight in between pregnancies. I think that's something that really isn't discussed even in our field
Yeah.
when, when they're like, oh, gee, whatever, how many pregnancies, how many babies to term. There's a lot of physical changes that go on with miscarriage. And so I feel like even base education isn't there for us. And sad that we kind of had to figure it out through our own experience.
Absolutely.
Do you kind of feel that way as well?
Oh, definitely. No, for
Yeah.
sure. And that's like a big piece. Like when I'm doing evaluations with, patients, yes, I'm asking, whether it's an abortion, whether it's a loss, because I want to have an understanding,
Hmm.
of like even between that time frame of like their current pregnancy and their
Yeah.
past pregnancies and like what occurred for them, like, whether it's physically, emotionally, what, if anything, did they do in order to be able to address that?
Yep.
Because in a lot of cases, most people don't. It's just, again, like society, and we don't do a great
Yeah.
job of grieving, and we don't provide a lot of good support. And like I think like even if patients work with doulas, I feel like it's getting better. Like now there
Right.
are bereavement doulas, or grief doulas. But I think like before that, it was just like if they're working with a midwife or a doula, beyond just like the regular doctor, OBGYN, then it's
Hmm.
just like, okay, you're no longer pregnant, you had the loss,
Right.
and then they're left kind of alone. There's no support for them
Yeah.
afterwards. Um, and so I think that is getting better. But yeah, it would be great to be able to have more education around that. Because yeah, I think just having an understanding of what the different types of losses are, I think is
Yeah.
really important. And then knowing that that person is postpartum, even if it's their first pregnancy,
Right.
still postpartum.
Exactly.
And like how can we still support them just in the same way that we're
Right.
supporting postpartum moms with a live baby? Can we
Right.
should still be able to reach out to them and say like, hey, I can still offer that same level of support for you,
Right.
so that way if the goal is to conceive in a year, or maybe take a break, and then just work
Yep.
on getting their bodies strong and healthy and
Hmm.
vibrant again, then we can also work on doing that as well too. So
Yeah.
it would be great if we offered that and helped support, more,
Yeah.
um, more folks,
Well, and
who
I think we have this skill set. I think there's a hesitancy um, in our field because we don't want to do the wrong thing.
Mhm.
We don't want to say the wrong thing. And but again, moms that carry a baby to term or their stillbirth or something along those lines, it's very much a postpartum situation, navigating postpartum
Oh, yeah.
hormones, kind of all of
Mhm.
that stuff. And I see questions on Facebook groups and stuff all the time. Hey, I have a patient, she just went through this. How do I support her? How do I, when is a good time to reach out and, have her come back in if there's like previously established care. What thoughts do you have as far as, recommendations for, postpartum professionals like us to, you know, eh, do the right thing if there's such a thing?
Yeah, I think that I think like just being able to reach out to them, and it can just be like, hey, just checking in, want to see how you're doing, reach out. or schedule, a session with me, just
Mhm.
in the same way that they would, for someone with a live, birth. I think like it's important to definitely to reach out, even if there was a loss.
Yeah.
I think that, and I would say it's, almost similar to anyone who is grieving a loss, that
Mhm.
it's really just be there to support them,
Yeah.
and even if it's in that first visit, like if it's like you're not getting through any physical exam,
Right.
and it's just like they just need someone who will listen to them. And I think
Yep.
that's all it needs to be. It's just like, hey, like let them know like, hey, like this is a safe space.
Mhm.
I want to know how I can support you, and if they want to talk,
Mhm.
they can talk. If they just want to like lay on the table, and even if it's just like just a general massage, because I
Mhm.
think like also just like that built up tension, which is potentially there,
Yeah.
of like stifling their grief, not allowing themselves to cry, of holding in their womb as well too, just like all of that built up tension,
Mhm.
and allowing a space like where they can just kind of like let go. Because yeah, then they're having, like, if they've had a loss, they're having to go out into the world, go back to work, go back to their
Right.
families, and pretend that everything is normal, and that
Right.
they've like moved on, they've carried on. They have to put up this face. And so it's this tension that is built up like over a long period of time. And so like even if it's just, I'm going to offer, just a general body work session, just like for overall support, I think could be a great thing.
Mhm.
Um, and I think that there's so much, that can be carried over, that if you don't know what to say, but if you are a really skilled body worker and you're great with your hands, like let your hands do the work. Like their
Mhm.
body will then, let go, or will speak to whatever it is that needs to be, released. Um, I think that those are some great ways, to that us providers can be able to do for them. So, whether it's just like, again, offering a safe space, let them talk, let them grieve, let them cry, let them scream, whatever it is that they need to do.
Yeah.
Yeah. And I don't think it has to have like, an agenda. Okay, we're going to cover this, we're going to do this. Like just holding space, just
Yeah.
allowing, just touching their body, touching their belly, even if it's just like work around, like for me, I'm like thinking like craniosacral. So even if it's just
Mhm.
like working on like vagus nerve, like
Yeah. Vagus
parasympathetic,
nerve for sure.
would be
Yeah.
really, really helpful. So I think that those are really gentle, foundational things, to work
Mhm.
on. And then I think then at least you're building really great rapport. They know that this is safe, that they can come back to you again, and then they would be, continue to come in and willing to work with you on other things, in
Yeah.
order to just help support their body. But I don't think that there is a wrong way, you
Yeah.
know.
I'm
Um,
I'm thinking about the opposite end of the spectrum where you have those people that, um, instead of those very kind of calm, touch supportive sorts of
mm,
things, they want movement. They need to
yes,
get
yeah,
all that stuff out. And again, we don't really have specific data related to post loss to say
hmm,
what you should or should not be doing. It really is, I think, in general, um, a return to activity postpartum. But again, I
hmm,
think there's nuance to it, to make sure that they're not over exercising,
true.
to make sure that they're getting sleep and making sure that they're supporting themselves with adequate nutrition and things like that. Thoughts on, how to provide guidance for somebody that might be choosing more that movement approach?
I mean, I think it would be very similar to if we're working with someone in postpartum,
Yeah.
who has a live baby, that it would just be starting with walking, and then working on building up endurance, over
Hmm.
time. Because that, at least that is an opportunity for them to be able to move. They
Yep.
can walk as quickly or as fast as they want. They're outside, they're in nature, being able to breathe fresh air. So then
Yep.
that's an opportunity for them to get movement in.
Hmm.
Um, I mean, I think like as part of the process of like letting them know, like going to a boxing class or doing like a really hard, hit class might not be beneficial at that moment, but knowing that yes, their body is still doing a lot in order to
Hmm.
recover and to heal from the loss, and then also from that pregnancy. So we still want to be able to treat and take care of your body in that exact same way.
Mhm.
So, I would say like, yes, it can be tapered, or increased over time. But that, yes, they can still be able to get like some level of movement. If they like doing yoga, that can also be something, worthwhile. That, like, yes, there are aspects of yoga where it can be a lot more gentle, a lot more, grounding, but then also they can also do some things that are like more upregulating. I think definitely utilizing the breath, can
Mhm.
also be so helpful. So like, even if they are going out for a brisk walk, they're having to, breathe a little bit harder. If they're going up hills, doing stairs, those are at least great ways that they can still get some of that energy and that frustration and anger out.
Yeah.
I know, because I remember like after, one of my losses, like I just wanted to go out for a run.
Yep.
And I'm not like, I used to run and I didn't want to, like, I'm not a runner, but it's like, I felt like just that I needed to move my energy.
Yep.
And so I understand, like, that desire and that need to go and do that. Um, I think that also, I mean, because I love practices of like Qigong as well too, where it is a
Mhm.
great way of like of moving
Yep.
energy, but it is also a very grounding practice. It can be, very uplifting as well too, and utilizing the breath. And it is a way of
Mhm.
also moving that energy. So especially if there's a practitioner who practices Qigong, and is willing to teach them, or if they know of a Qigong practitioner, that might be really great to send to them on a way of helping them move their energy, especially if it's, depending on if the loss, how far along the loss was, or
Right.
if their body is still in a lot of recovery and it's not safe for them to move their body, in a really strong or aggressive way, then we need to find other ways that they can still move that energy.
Mhm.
I think breath, like pranayama breathing, because there's lots of different ways of breathing.
Yep.
And so even utilizing that and having them go through, certain breathing practices of moving that breath, which also is going to also move the lungs, which
Mhm.
also is part of grief as well too. And that can also be a really great way of also releasing. So I think there are different ways, especially for someone who, is like, an athlete or very active, and they
Mhm.
feel like they need to do something physical to be able to move their anger. Those might be, some really good options.
Yeah. And I mean, just a note here. We don't have data to say you should do X, Y, and Z. And that's where I
No.
think it's one of those things that you have to combine, you know, what are some general goals we want to calm that nervous system that ideally we're thinking is probably upregulated and really not happy with the current scenario. We want to you know, get reconnected to our body again, process
Mm-hmm.
the grief again, and that can look a lot of different ways. You have a fun practice with pole dancing, and
Oh
sometimes you
yeah.
throw in some roller skating with it,
Yeah,
which I'm
I
like, oh my
do.
god, that's amazing. How did you get into that?
Well, funny enough, like you had mentioned about how you were running before and you got into yoga
Hmm.
after your loss. I was doing yoga um, around the time that I had my loss,
Hmm.
and that wasn't for me. Like
Mm.
I couldn't go back. Like I was still teaching, but that
Hmm.
wasn't a practice that I needed anymore.
Yep.
And so I found a pole studio. I needed to move my body in a different way. And so for me, like, yeah,
Yep.
that was my thing of like, I need to physically move my body, but
Yep.
in a really different way than how I had been moving it. And so I found pole and I did that. Like, I think it was just within a few months of
Hmm.
my first loss. And I loved it because it was just, I had to think differently, in how I
Right.
moved. And also just like, yes, like it is a very physically active, like having to climb the pole, having to control your body around the pole, is just very different than how especially with the type of yoga that I practice, which was very structured. It was
Yep.
like, do this, do this, do this, because I did vinyasa and I did Ashtanga vinyasa, and it has like, you do this, then you do this pose, then you do this pose.
Hmm.
Whereas like with pole, it was very, I'm going to say like it's very unstructured. You can do this movement, you can do that movement, and then you can string them together. You can spin around the pole, and I don't want to say it was like chaotic, but it was freeing to be able to move
Yeah.
in a very different way. Um, and like currently, like I love roller skating, so like for me, again, like I needed something fun, like
Yeah.
my
It
my
looked
last
cool.
loss, yeah, my last loss was 2 years ago,
Hmm.
so. And with that, and roller skating was something I took up during COVID, but it was a way of like putting on headphones, listening to music, just
Yep.
being out, and it didn't have to look perfect. It was
Yep.
just me doing my thing, and that has given me a really great sense of freedom.
Hmm.
Um, and I think, for me, as someone who is still, I've had, like I always say, like I've had 5 pregnancies, but I've only had one live birth, so I have been like through this grief like over and over and over again, and struggling with fertility and struggling with like being able to conceive, and like how can I still find joy, because again, like that at the end of the day, like that's what I want. When I do movement, it's not just for the sake of doing movement. I want to feel good.
Yeah.
I want to find joy. I want to find moments of happiness, even as I'm still stuck in that grief. And
Hmm.
so yeah, like I love I whether it's doing pole and like there's beauty around it, or like if I'm roller skating and it's just like it's fun and I get to listen to whatever music I want to listen to while I roller skate. And those are ways that I can still be able to find moments of joy,
Hmm.
while grieving. And that's something that I'm hoping that patients are able to find. And like that is one of the
Yeah.
things, like, they're always asking like, well, what can I do afterwards? And especially if it's been like now a couple of weeks or it's been a couple of months and their body is healing, it's doing better, and they don't want to go back to what they were doing before.
Right.
They're looking for like, and in a way, like that's what grief does. It just like it
Yep.
really, it bubbles up like, okay, like you've crossed this veil now, so like it's, you can't unsee it, and it's like, okay, like how are you
Right.
going to move forward, you know um and so it really, I think, throws you into like, okay, well, what's important, and so it's, I find that it's really important to have that conversation with patients on like, well, what can we do, like, it's a matter of like
Right.
finding, how can you find joy again.
Yeah.
um
And it might not be something that you expect either, kind of
no,
like you found pole dancing.
yeah,
I think, again, the more you realize that there's no right way to do this, um, the better. I mean,
yeah.
when you're working with this population, how do you keep from being re-traumatized? Because I know, again, I only had one. If I'm talking to a patient and it's very acute, sometimes I don't see it coming. I'll be in tears.
Mhm.
How do you protect yourself as a provider from re-traumatizing?
Um, I mean, I have to say that I feel like, because I have done some work,
Mhm.
around protecting my peace and creating space, around that. I think it's important that I have a sounding board of someone who I can talk to, or a
Yep.
way of being able to process what, I experienced, with that particular session. So it's not,
Mhm.
just staying, within me. So whether it's talking with my partner, whether it's journaling, whether it's writing, so having some way of being able to, put on paper or to voice like, okay, this
Mhm.
is the emotions and what kind of came up for me. Um, but also there are moments where like I'm sitting, with the patient right in front of me and they're talking to me, and my tears will well up. And I think then
Yeah.
that shows like, hey, I'm human too. Like I empathize. Like it's, yeah, it's more than just like sympathy, but like I empathize. Like I know what you're going through. I've been
Mhm.
there. Um, and I think it would be, you know, yeah, it would be really hard for me to just kind of put like up a stone face and like
Mhm.
just like listening and just, nodding and agreeing,
Yep.
but yeah, like I feel like, yeah, I wear my heart on my sleeve sometimes. And so, my tears will well up, when they're
Mhm.
talking about it. Um and so yeah, I think that it's okay. I
Yeah.
think sometimes we feel that we're supposed to be the bigger person or be like the stronger person.
Mhm.
And I don't think, especially when it comes to grief and especially when it comes to pregnancy loss,
Yeah.
you know. So yeah, I think that that's a little bit of what occurs for me. But also like I do, especially like if I know, okay, I'm going to be working with, if it's a new eval and I know I'm going to be like having to hear their story,
Yep.
like beforehand, I am doing
Right.
work in order to kind of stay grounded,
Mhm.
working with my breath, just knowing that like I have good support,
Mhm.
overall, and that also after the session, before I have my next patient, that I'm also doing something to help to kind of clear that
Right.
energy, that down energy, whether it's moving my body or going outside for a walk,
Right.
just doing something just to kind of, cleanse my hands of that, of, what I experience, I
Yeah.
feel like is also really helpful.
If thinking about those who may be working with somebody who has gone through loss and they haven't experienced that for themselves for whatever reason,
Hmm.
um, any advice for them on how to support that patient? Because I think for those of us who've, you know, had to navigate that, I think you kind of there's like a knowing. I don't know. I can't explain it.
Yeah.
Like there's just
Hmm.
you're like, no, but if you haven't, um, I guess on the part of the patient, do you think that I think they probably wonder if there's an expectation on the part of the patient to be like, should you understand this? Should you acknowledge this in a certain way? Like, I don't know that there's a lot of guidance for somebody who hasn't experienced that. Like, what do I say? Do I say I'm sorry? Do I ask more questions? Like, what's kind of a good guideline or good guidance to help
Hmm.
somebody?
Um, I would say like, yeah, I think, to, it's not, I'm going to say like apologizing, but I think it's just like acknowledging like, yeah, I'm sorry that you had your
Yeah.
loss. Um, Knowing, like asking, I think it's okay to ask questions. I think if that patient is seeking out support,
Yep.
then they know that that is going to be part of the process of like
Hmm.
being, I'm gonna say like regurgitating, everything that occurred. But yes, to be able to, go through, okay, this is what occurred, this is what happened, this is
Yeah.
when I had the loss. So I think like on the part of the patient, like they know that that potentially will come up.
Yeah.
So I think for the provider, it should be, for them to understand, like, yeah, it's okay. Like I think they want you to ask the questions, like maybe the
Hmm.
questions that nobody has really asked them, because again, like for a lot of providers, it's like, okay, it's done, you should be over it, you need to move on, let's try
Yeah.
to get you pregnant again,
Right.
so for them, I think like, yeah, like ask the questions. Obviously, know that it should be tasteful, it shouldn't be and again, like, yeah, that's up to the person,
Right.
you're hoping that the person that you're working with is like empathetic as well too.
Yeah.
um but I think, and I think it can be helpful, especially if providers want to work with this population of folks,
Hmm.
whether it's to receive some type of training around holding space. I think
Yeah.
that's the biggest thing. And there are people who provide training around holding space, like after a loss,
Hmm.
or even grief work training as well
Hmm.
too. I think is worthwhile to take. And there are, some great I know, like I'm forgetting her last name right now, but I know like she's a really great author who has written several books
Hmm.
around grief. I think even reading a book about grief, can be really
Yeah.
important. So I don't think it would behoove the provider to just like go, hog wild into this without really having even just a really basic, understanding and a
Hmm.
foundation of like, the different stages of grief, even though I know like it's
Right.
around like theorized as to whether that is like true, but also like
Right.
understand, what it is that they're going through, how you can help to support that person. Um, and knowing that grief it's something you can't get rid of,
Hmm.
it's something that hopefully the person's life continues to grow around that grief.
Right.
And then to be able to help support them and to find that it's going to be, when you are working with them, it's going to be more than just the physical, but also
Hmm.
it's going to be the mental, it's going to be the emotional, which will then
Hmm.
come back into the physical and how that might manifest as pain. And that when you are working, if it is pain that's coming up for them,
Hmm.
or if it's like, they're struggling with fertility and they're wanting to conceive again, like after they had the loss,
Hmm.
that again, that it is like a very much a psychosomatic, component, to it, and that you have to
Hmm.
work with both of them. You have to work with the nervous system just as you are working with the
Right.
tissues as well.
Right.
So I think that hopefully that provider is holistically minded, and
Hmm.
that they are looking at all of those different aspects. So I would say like that would be a really a big thing is seek out training, even or
Hmm.
even in just a book, like even if it's just like, reading a book, around it. I have like right now just uh, Ellen just wrote this book, to tend and to hold.
Mhm.
And so, which is a great book to read because it is around pregnancy loss. And so, around infant loss and just like how to honor, the grief.
Mhm.
And so, if they're looking, like, okay, how can I support someone? This would be a great book to read. Or if it's just, general grief,
Mhm.
you know, we need to have better knowledge and education around
Right.
it in general,
Yeah.
and know how we can help to support them. So that would be like my go-to. I have read some
Yeah.
books around grief, and I've done some training around holding space.
Yep.
And so for me, like, I feel like, yes, like I feel confident, when I'm working
Yeah.
with those patients. So that's what I would recommend. And then it would be great if it was, even part of PT school, to be able to offer that. I know that that would never, in PT school, but then I think if you're going the route of like pelvic floor PT,
Yeah.
that, you know, yeah, because I can't even think of in any of the Con Ed courses if there
Mm-mm.
is anything specific to
Nope.
grief. So yeah,
No, isn't that funny that we're in service professions, but we deal with humans every day, but we're not trained in any of that. Even
yeah,
just the basic, as you were talking, I was thinking, even just basic consent of, do you mind if I ask you some questions about this, or are you okay talking about this? It
mhm,
goes a long way,
yeah,
because I do think, especially if you're talking to people that might be uncomfortable talking about it,
hmm,
um, we need to know that. I mean, I have found that the more that I have spoken about it, and it sounds like you have too, the more people come out of the woodwork and say, yeah, I've experienced this too. And then you have some great conversations about what you experience. I very seldom run into people who, um, unless it's very, very acute,
hmm,
don't have something that they want to share or talk about.
yeah,
But again, having that opportunity to consent, whether you want to have that conversation or not, and then if they do consent, yes, definitely have some things prepared to be able to support that,
yes,
for sure. So
yeah,
yeah,
definitely,
but yeah, no, to your point, I mean, of all the additional things that need to be added to PT school,
yes.
some sort of how do you manage your patient training? Like, yeah, I mean, if you have a patient that's upset, how do you navigate these basic human emotions? Navigating loss and whatever that might look like.
Yeah. And grief
For
comes
sure.
up, like, and again, it doesn't have to just be pregnancy loss. Like,
Right.
in the book that, like my book, Tending to Your Womb, like I talk about grief as in a lot of different aspects. So,
Hmm.
and again, like I'm, pertaining to like, those with wombs. So like that population, but if it's, the grief around, even in postpartum, like even if you have a live living child, baby,
Yeah.
there's like a grief around your loss of identity, like
Hmm.
as like the athlete or the career person, and now you're a mom, or the grief around what your life used to be,
Yeah.
or the grief of like what your body used to be,
Hmm.
or grief around, especially like if you're dealing with a condition like prolapse or incontinence,
Right.
any of those things, like it changes your quality of
Very
life.
much
It
so.
changes like how you have to move through the world, and there is a certain level of grief around that. And I think like just, even for like, yeah, you have a healthy baby, but okay, well, how are we also caring for the mom
Right.
and like the grief that they're going through as well too? And I know like it's a much bigger conversation because like we don't care for moms,
Right.
especially when it comes to like the care gap and childcare and all of those other things. But I
Yeah.
mean, like there's a huge level of grief around that, and then
Hmm.
having to be like the primary caretaker. But then also, if it's like someone who is struggling with fertility, so and then they aren't able to conceive naturally and they have to go through IVF, or they
Right.
have to do surrogacy. There's a grief of like, I'm never going to have like my own kids, like of my own genetics, as well
Hmm.
too, or having to go through adoption. There's so many levels of grief. And I think like just in general, it would be great for us as providers, to be able to have just, yeah,
Yeah.
how can we be able to hold space, like, because we spend the most amount of time with our patients and those
Right.
conversations will come up, and how can we still provide support for them, I think is
Yeah.
so important.
That's such a relevant point, even beyond loss of an infant, is, those of us who are dealing with pelvic floor issues on a regular basis. You mentioned prolapse. That's a huge one. I feel like of
Hmm.
all the issues, that's one where I think it really messes with people's heads the
Yeah.
most. Um, if people didn't have a birth go the way that they had hoped, and then they have physical implications after that, how they anticipated their postpartum being, how they anticipate, how they're planning for their future, all of that. Like, I think that's stuff that, even though we are not, mental health providers, we have to acknowledge that,
Mm-hmm.
like you said, hold space for it, and then know when to refer when appropriate. Because I don't think we can do our jobs just sticking to the black and white.
Yeah.
It's not, you just can't, like,
It's not black
no,
and
it's not
white.
at all.
Yeah.
It's,
Yeah.
and to your point too, I mean, having navigated, pelvic pain, like, how many patients do we know that have pelvic floor issues from high tone pelvic floor, and we go back and there's some sort of birth trauma, or there's some sort of unmet expectations or things like that. Like, we have to lay it out there and figure out a way to navigate it, and maybe, we provide some guidance, and maybe, we refer out. But
Mm-hmm.
um there's so many, I think, physiological implications to that. And no, it's so strange that we don't get any sort of, it's like we're trained as computers, right? Like,
Yes. Or just as manual therapists, that we're just
yeah,
using our hands, and it's so
yeah.
much more than that.
And that's also too where, again, I think some people get frustrated a little bit with pelvic health, because there can be what some people call like a woo aspect to it. There's some providers that I work with in my
Mm.
area that are amazing, craniosacral, visceral, somatoemotion, like, are so good at that. That is not my skill set. But
Mm-hmm.
there are patients that need that.
Yeah.
And so that's when we go to evidence informed versus, everything has to be written in stone, is like, okay, I know what I can do, but I also know where they can benefit from touch and from some of these other providers that have a different skill set from me.
Yeah.
And that's where I'm like, you know what, you need to help provide resources for that person in front of you and what their needs are.
Mm-hmm.
So that's part of the reason I love our field, is because there is so much of that. It used to be an APT slogan. It used to be like, the science of healing, the art of caring. It was so
Yeah.
corny. But I'm like, no, that kind of is it, especially
No,
with
that is.
something so emotional and vulnerable as navigating, um, matrescence, or whatever we're going to call it at this point. So,
Mm-hmm.
I'm glad
Absolutely.
you kind of talked about that postpartum piece. And
Yes.
then looking ahead, because, we're catching up to, perimenopause and menopause, the grief that comes with
Yeah.
that.
Yes.
That's a
Yeah,
new
I think
one.
I think that's huge. And I think, like, yes, I mean, the conversation around perimenopause and menopause is big. I think with social media, a lot of
Mhm.
influence, like, and celebrities who are going through perimenopause and menopause,
Yep.
I think that we're hearing about it a lot more.
Yep.
But yeah, there's definitely that grief and that loss aspect, around feeling, for some people are really happy to, like, no longer ever have a period again. So, but also I think for others, and I would say, like, I'm going to speak for myself as well too, like, knowing, like, I'm 45, I'm still wanting to, like, try to have another child, but
Mm.
also knowing, like, okay, I will be on the cusp of perimenopause very soon.
Mhm.
And, like, what does that mean for my fertility? What does that
Right.
mean? Like, especially because there are, women who are having babies a lot later,
Yes.
and, like, so there can be that grief of, like, well, what happened? Like, does that mean I'm no longer able to be a mom?
Yeah.
Some people, enjoy, like, because, like, having a period, like, it's a woman, it's like that's part of the process of being a woman, is like shedding the blood every month. And so a loss around that, and what does that mean for your own womanhood?
Mhm.
And I think also the way that we treat women who are in their 50s and 60s and later, where now they're just like, an old hag, or, they're just, like, no longer relevant anymore in the world. And so that also feels really scary as well too.
Yeah.
Whether it's in our careers, in our marital relationships, amongst our
Mhm.
friends, just like, just generally out in the world, where, like, now we're no longer the maiden, or the mother, and where people
Right.
depended on us. And now no one depends on us anymore, and so we might just be forgotten. So I think that there's also like a really big loss, around that, other than just like what's happening physically with like hot flashes and loss of
There's
sleep and depression.
There's a little bit going on. I'll give you the cliff notes on that, what's coming up. No, it's funny. About a year ago, I really, really long story short, had high blood pressure, came off oral contraceptives.
Hmm.
Cycle didn't come back, and I was like, oh, and I was sad for a second, and then things eventually did. We're navigating Perry, the short answer.
Yeah.
And somewhere in there is also you get weeks sometimes where it's like a teenage murder scene, and then you're like, no, I'm not mourning this anymore. So you're navigating those highs and lows, but then all at the
Yeah.
same time, like my daughter's 11. I feel like she's entering this. I'm
Yeah. And
exiting
sitting,
this.
yeah.
Um,
That's
how
crazy.
do I not project all my feelings onto her? How do I give her more education? How do I educate my son to understand these things so he's not freaking clueless? Like,
Yeah.
there's a lot. So buckle up is
Yes.
all I'm gonna say is buckle
Okay.
up. Whoever planned it this way was really like, that's kind of cruel where you're like, "Oop, we're bypassing in the night
No, definitely.
and feel bad
Wow.
for everybody else in our household.
Yeah.
So for you looking ahead, you've got you mentioned you've got the book ideally coming out hopefully summer 2025.
Yep.
Tell us a little bit about kind of what that process has been, kind of writing a book about all of this, and kind of navigating that whole thing.
Yeah. So the book is called Tending to Your Womb. Subtitle is A Journey Through Grief, A Journey Through Joy, Grief, and Self-Discovery. And so it's been, yeah, pretty much all of 2024 of writing this book. And it will be coming out June 2025. And yeah, amidst my practice and working and having a family and writing a book, it was really, really challenging. It was hard. But luckily, there were moments where I was just really, really inspired. And so
Mhm.
the words just kind of like flowed easily. And other times where it was really hard. It was hard to kind of come up with, how do I put into words the things that I'm feeling that's
Mhm.
important that I want to convey. One of the things that I love about the book is that I've included a lot of stories. And
Yeah.
so that it's more than just my story. I definitely share my story, and it's in bits and pieces, throughout the book, but also of others.
Mhm.
So I definitely have like one of the chapters that I like, which I feel like, if you get like a standard pregnancy book, it doesn't really go into depth about what are the complications that you can
Yeah.
experience during pregnancy. And so I have a chapter, I think it's called like, when you, because it's all about journey, the whole path of reproduction. But like going through bumps in the road, in pregnancy. And so whether it's like hypertension, if it's like the hyperemesis, like gravida, the vomiting,
Mhm.
extensive vomiting that happens during pregnancy, and lots of other complications that can come up.
Mhm.
And I have stories, from other moms like who just really share, so that you can actually, because you always hear about the birth story, just like
Right.
what happened, like just like from the time you went into labor until the baby's born. But what also
Mhm.
happens like during pregnancy when you're also having to
Right.
navigate a pregnancy, and also hypertension, or all these
Mhm.
other things, and having to take medication, or how you have to go and change, how you're eating, how you're moving, if
Right.
you're, now bedridden, and all these things. And I think it's so important. Again, like I want this book to be a book that someone can pick up, and like it's an addendum to like what to expect when you're
Yeah.
expecting. It's like, okay, well, what about what can I expect when I'm expecting that I didn't know about,
Right.
or know enough about, that I
Yep.
have a little bit more knowledge and information.
Yep.
Because again, that isn't really talked about very much, and it's not until, and it's always so compelling when I meet a patient who is like, I didn't know about this, no one
I
told me about
know.
this.
Yep.
And it's like, yeah, that's really unfortunate. You should have this information, even if it's just like, oh, okay, I read it in
You're
passing.
just aware of it, right?
Yeah,
Yep.
just be aware of it, so that way
Yeah.
it doesn't come blindsided. And then like your whole pregnancy or your whole postpartum, or, you know, whatever issue it is that you're dealing with,
Mhm.
you're having to like now navigate it for the first time, or, educate, people around you or your family around it as well too, which is so
Yeah.
tough. And definitely when it comes to loss as well, because
Mhm.
most people again assume, we're all very naive, like, yeah, you'll just get
It'll
pregnant
be
and you'll
fine,
have your
right.
baby, everything will be fine. And
Yep.
that isn't the case. And I think, like, I'm hoping that this book will also be, something for family members, for partners, that they'll also read, so that they can also
Yeah.
understand what their partners are going through,
Mhm.
whether it's during, as they're going through, their period, or whether they're going through postpartum, or if they're going through menopause, like
Yeah.
have a better understanding of what their partner is going through. So my
Mhm.
hope is that this book is, it's not just for the person who has a womb, but also those who love others who have wombs, whether it's your sister, your mother, your grandmother, your best friend, anything like that. And so there's so many great aspects, to the book. One of my favorite chapters is like around what we're experiencing right now in the world around climate change, and how
Yeah.
that also is having a big impact, on our womb as well too. There's like, and again, like, we already are seeing this happen mostly in third world countries, where the things that they are not having any contribution to global warming, but they're being the hardest hit.
Right.
And like in Bangladesh is like one great example where, they're, especially, like fast fashion. I talk about fast fashion and how
Mhm.
like all the synthetic dyes and all of like the PFAs and all the chemicals that are being used for clothes, but then that's going into the water,
Right.
that's affecting, where they fish and where they clothe and where they bathe and, wash their clothes. And then that's having an impact on, obviously global warming, and then how the ocean is also feeding into like the riverbeds. And so then these women are having to stand in the salty water for hours in order to go and get food. But then salt does not really do really well in our bodies. And now they're getting hysterectomies, and they're having all
Mm.
these like pelvic floor issues,
Hmm.
because of this is their livelihood, like, of like fishing and doing the things, like they're a water environment, or, that's like their environment, it's right there. But there's a lot of other stories in there as well too. And I think, if we're thinking about just how we are caring for ourselves, and the biggest thing is like, how can we build self-care practices, is like, it's also everything that we're consuming, that we're eating, that we're putting on ourselves. All of that will have an effect on the womb, and I don't think people really think about that very much
Mhm.
until an issue comes up. And
Mhm.
especially, because the book is definitely heavy around fertility and around conception, but also if someone is wanting to look at how they are like improving their fertility to be able to conceive, to also
Mhm.
look at like, what are your practices, in regards to how you are moving through the world, and how are you contributing to global warming and to climate change, and then how is this also negatively impacting your womb at the same time. And so I see the earth as like, it's our big garden, and so we have our own internal garden as well too. And that's why I call it like tending to your womb, because it's the same way of like tending to your garden. When you have weeds, and how you're tending to it, or you're growing flowers. And I want the way that we care for ourselves to be in the same way that hopefully we care for our garden, our little patch of, land that we have, or how we take care of the earth, as a whole. So I'm hoping that, it just really kind of like comes full circle. And yeah, that's like, yeah, there's a lot of different components to the book, but I'm really excited about it. It's, again, it's like the book that I wish that I had, after I had
Yeah.
lost, and I'm hoping that other people are excited about it too.
I
So
love that. I love
yeah,
that. Can't wait for it.
thank
All
you.
right. At the end of every show, we have some questions.
Okay, sure.
So, first one, what's something that you're reading or a podcast that you're listening to right now?
I'm not a real big podcast person, but a book that, I just finished reading one book, and that was actually the mind body connection,
Mhm.
to fertility. So, kind of looking at, the practice of hypnosis, um,
Mm.
helping with, conception. But I just finished that book, and the book that I'm actually reading right now, I'm not remembering the name, but it's around dreams. And
Ah.
I love it because I have really, vibrant dreams,
Mhm.
and I know that there definitely is meaning and there can be healing around dreams.
Mhm.
And so I'm looking at the process of, writing my dreams down, and then being able to, figure out how I can use this to serve me, or like my purpose in life. or to bring healing, into my life as well too. So I'm really excited about diving into that book.
I love that, which means you're getting good sleep, right?
I am. I do get really good sleep, other than from my cat waking me up. So yes.
I love that. My dog wakes me up. Sometimes she'll like sleep lick, and she'll be like
Oh,
lick,
oh,
lick, lick, and I was like, wait,
yeah.
don't wake me up. I know you're having a great dream. You're not helping me.
Yeah, yeah.
Favorite activity since becoming a mom, and it doesn't necessarily have to do with your daughter.
Well, I would say, I mean, like my biggest activity is really just it's roller skating. Like that's what I really love doing, and
That's
the
so
nice thing is I
cool.
get to do it with her.
Hmm.
I mean, like I said, I started it in COVID, and I'm getting better at it, and it's really, really fun. And it's really fun doing it with her because she's absolutely fearless. Like she will
Yes.
do like crazy moves that like I don't feel comfortable doing.
Yeah,
So that's a really fun activity,
that's
that I
awesome.
get to do with her.
Are you gonna have you checked out roller derby?
I haven't.
I had a
And I
friend
know
that
really?
did, and she's like the sweetest, kindest, most well-spoken, like very just sweet. And then she gets out there and she's nasty.
Really? That's a
I
great
love
way
it.
of
It's like an
moving
alter
energy.
ego.
That's awesome.
Total alter ego. So that's out there for you in case you
Yes.
need another outlet.
Okay.
All right. What's one piece of advice for moms?
Oh, that's such a tough
I
question.
know.
Oh my gosh.
No
I
wrong
mean,
answer.
I would also say like it would be one that I would give to myself, and also like I'm thinking of my mom that I would also give
Mm,
to her as well. It's like find small moments to care for yourself.
mm,
I feel like, like, yes, my practice is self-care physio. And I feel like sometimes like self-care is like this big term,
mm-hmm,
but for me, it's like, how can you find the little nuggets like in your everyday where you
mm-hmm,
can be able to care for yourself? So even if it's just like, um, or finding pleasure, that's also another big thing. So I find like, are both like, it should be pleasurable to care for yourself. So like,
mm-hmm,
even if it's, which is like a really simple act, but like if you're washing dishes, like, okay, yes, that's the chore you're doing, but how good does it feel to have like the slipperiness of the soap, or the warmth of the water like on your hands? And
mm-hmm,
that can be like one moment of like, oh, I can like sink into that moment of like pleasure and of caring for myself, and I'm able to ground, and I'm able to breathe, and I'm able to be present into what I'm doing. um, or even, if it's looking at your child, and like as they're playing, but then that's a moment of just being present, and just
yeah.
like witnessing their pure joy, of just playing and being, fascinated with their toy or whatever it is that they're doing, or whatever it is that they're showing you. And I think that can also kind of bring you back to you. So I would say that that's the biggest thing, is it's like, yeah, it's being present so that you can be able to find more pleasure and find more care for yourself.
I love that.
Yeah.
Who is someone in your space right now that has your attention? Who are you fangirling over?
Mm, what am I fangirling over? I would have to like think about like my Instagram feed right now.
Ah,
Because that's like who it is. Um, oh my gosh. Oh, I hate I'm being put on the spot.
sorry.
Mm, oh,
It can be somebody you fangirled in the past. It doesn't necessarily have to be right now.
yeah. I mean, I would probably. Oh my gosh. I mean, I'm gonna call her out just because, like, her book just came out. It's actually
Yeah.
the book that, so like Eileen
Yeah, sure.
as Rosette, so
Hmm.
she, just came out with the book To Tend and to Hold. I was supposed to, hopefully meet up with her last week when she did like a book signing and talk in LA, and I didn't get a chance to.
Mm,
But yeah, no, I think like, the book that she's putting out for the world, I think is great. I think it's the first real book of its kind to really look at honoring grief,
mhm,
especially in the postpartum space. And she
mhm,
does, like, she talks about like how grief after a loss is postpartum. And so like I feel like she's one other person, other than me, who's talking
mhm.
about it. So I guess like right now, and I definitely see like a lot of her feed and stuff, so she's probably one person I'm fangirling
Love
over
it.
right now. So yeah.
Awesome. All right. And then the last thing, what does it mean to you to be an active mom?
It's to find movement in everything, in every day. So I'm not the type of person who used to just do an hour-long exercise. I still find time to like just find 20 minutes, but even if it's like I have 5 minutes, like even between patients, how can I still find movement? Whether it's like, okay, I have a kettlebell, let me do like a couple of kettlebell swings, like let me take like go for a walk. Let me do, my mobility, like nerve flossing because I'm dealing with like tennis elbow. Like, how can I find movement in my everyday? Being playful with my daughter as well too. Like she's 10, but like even like, okay, my husband's making dinner and we have like 30 minutes to do
Mm-hmm.
something. And sometimes like she'll want to be physical. As like even
Yep.
as a 10-year-old, like which is great, like whether it's I'm giving her a piggyback ride or we're playing some type of game. Is like I feel like those are, and I like I'm out of breath like having to like do things,
Yeah.
or cartwheels. Like she'll show me a cartwheel and it's like, okay, let me go and try it. So I feel like, and that is exercise and it's
Yep.
movement, but I'm doing it with her,
Yeah.
and then she sees me doing those activities, and which
Yep.
I'm hoping like that will feed into like her, like her continue to be active like throughout her
Yeah.
adulthood as well too. So
That's the
yeah.
hope, right?
Yes, definitely. Yeah.
That's the hope. All right. If you guys would like to know more about Tia, you can find her on Instagram, Self-Care Physio. And hopefully this summer, we can't wait for her book to come out
Yes, thank you.
2025.
Thank
Thanks, Tia, so
you.
much for joining me. Glad we got to catch up, and we're excited
Absolutely.
for the book to come.
Great. Thank you so much, Carrie.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.